Last week I was in Geneva for the World Health Assembly. And no, I wasn't actually in the assembly. I wasn't voting on anything. I was doing what almost everybody is doing that week, which is going to panel discussions and attending events and meeting other global health organizations. But honestly, the mood in Geneva was really different this year because global health is in the middle of a major funding crisis. It's not just the US that has pulled back, but all of the European countries. The WHO has fired a lot of staff. The Global Fund is having problems raising money. But if you're in these rooms and listening to these panel discussions, it doesn't sound like a financial crisis. It kind of sounds like a strategy meeting. People are talking about global health reform and sustainability, and yet nobody's talking about who actually caused the crisis, the ones who actually cut all of their budget line. But that's kind of the trick, right? Are we actually reforming global health? Or are we just learning how to talk about doing less global health? If you are not following global health funding flows, all of this may seem a little vague. So let me give you the basics. Global health and humanitarian aid are not undergoing a small budget adjustment. This is not a normal budget cycle. This is a major contraction. USAID was dismantled almost overnight, and thousands of projects were just terminated, leaving countries and patients in the lurch. That money is real healthcare. It pays for drugs, pays for transport, it pays for laboratory tests. It pays for diagnosis and treatment. So when you cut that funding abruptly, you don't get global health reform, you just get disruption. Take Ismail, for example, a community health worker in southwestern Uganda. He was getting $50 a month as part of a USAID funded grant. When that grant was cut abruptly, he lost his salary. One of his patients, a 14-year-old girl, didn't have transport money to get to the clinic. She stops taking her HIV medicines, and she actually dies in his arms. This is the way budget cuts translate into clinical outcomes. Salaries disappear, transport money goes away, supply chains are disrupted, and a 14-year-old girl doesn't get her HIV medicines and dies a preventable death. And keep that very simple mechanism in your head as we start talking about the terminology of global health and sustainable development. Take integration, for instance. Yeah, it's a little ridiculous when the HIV program has its own staff, the malaria program has its own staff, diagnostics, and the TB program has its own programs and supply chain. If you can integrate these vertical programs, theoretically, you can make this more efficient, but in reality, it's a lot more complicated in poor countries where everything is dependent on donor funding. When external funding gets cut, you don't get magical integration. You just get less health workers, less drugs, less testing. That's not integration. That's just dumping. So when somebody says we need to have integration of vertical silos, you need to ask, are you trying to integrate things so you get better care for patients? Or are you just trying to spend less money? Country ownership is also a good idea. It means that countries should not just be doing what the donor tells them to do. They should set their own health priorities. They should have the flexibility to try out creative new ideas. They shouldn't have their priorities set by DC or London or Geneva or Seattle. But country ownership with resources is a lot different than country ownership when all the money is gone. And this is where the blame starts being shifted downstream. So when people are talking about country ownership, you should ask, ownership of what? A stronger healthcare system, or just the aftermath after all the donors have left? Sustainability is probably the most abused word of all. Sustainability for whom? The program becomes sustainable for the donor if they cut it out of its budget. But that doesn't mean that it's sustainable for the patient. Is the patient still getting medications? Is the health worker still being paid? That's real sustainability when health services continue. Fake sustainability means that the donor doesn't have to pay for it anymore. So when somebody says sustainability, ask what is being sustained? The program, the health services, or the donor's budget? So why is everybody talking this way? Some of it is just the way everybody has been talking for years. But something else is going on right now. This language solves problems for everybody. For donors, it turns a cut into a strategy. They're not abandoning a program, they are promoting sustainability. For NGOs and UN agencies, the language is also useful. Because if you're trying to survive a funding collapse, you just can't sit around and say, wow, we lost all of our money and now we're really screwed. You have to be creative and innovative. It's also the language of institutional survival. And for conferences like these is actually perfect because nobody wants to go to a side event at the WHA that has the title, we lost all of our funding and all of our patients are going to die. So instead, you get a panel about reimagining global health or reform in an era of the new global health financing. But there's a real danger here because if we start describing this crisis as global health reform, then we stop asking questions about who caused the crisis in the first place. The donor cuts the funding, but we are asking, why are countries not taking more ownership? Why are NGOs so inefficient and bloated? Why are these healthcare systems so weak? We allow the blame to move downstream and allow the funder to conveniently disappear from the entire story. So when you hear these words like integration or country ownership or sustainability, don't just nod along. Ask the underlying question. Who caused the funding collapse? Because if we don't ask that question, then the funders are never challenged. The money just disappears and the people downstream are told to become more efficient and more sustainable. If the health center isn't open, if the community health workers are not paid, if the drugs are disappearing, if patients can't get their tests and are dying from preventable illnesses, it really doesn't matter how nice your PowerPoint looks. This is not global health reform. It's just a funding collapse. And if we can't say that plainly in these fancy meetings in Geneva, well, we better all find another line of work. What is going on at the US government at the highest levels for global health is completely unprecedented. There's money out there, no question about it. Billions of dollars, but where is it actually going? It's chaos, it's completely mismanaged. You can learn more about this in my video on the US government global health funding flows. I'll see you next time.